Hello, I'm Dr. Francois Beitou. I'm the Director of Rehabilitation Services at the Manon Center. Today, one of our patients joined us to discuss the treatment options for a frequent symptom of MS, which is spasticity.
Being that I am an MS patient, I would be interested in what kinds of specific treatment you might have me do.
That's an excellent question. I'm going to start by stating that spasticity does not always need to be treated, or not necessarily treated aggressively. What I mean by this is that spasticity may have actually positive consequences. For example, it may help compensate for muscle weakness. And also, in quite a few cases, spasticity is present but not bothersome, and therefore it doesn't necessarily need to be treated with medication or other means. However, we often recommend to discuss the spasticity with a healthcare provider and also to put in place some very simple management. For example, we recommend that everybody who has spasticity have a home stretching program, which means that every day you would perform stretching exercises, for example, on the legs or on the arms, basically on the part of the body that is experiencing spasticity.
How long-term is that symptom in MS?
So typically, spasticity tends to stay on the long term, although it can vary in its severity. And we do think, and we have evidence to support that if spasticity is addressed and treated properly, we may be able to slow down its worsening over time, or maybe to avoid some of the adverse consequences of the symptom.
Are there any specific medicines that a person could use to improve their spasticity?
Yes, there are several medicines. It's important to recognize that these medicines are symptomatic medications, which means that they are meant to treat the symptom, but not to treat the disease. However, they can alleviate the severity of the symptoms, even if they don't make them completely disappear. Such medications, for example, are a medication called Baclofen, another one is called tizanidine, another one is called dantrolene, and there are other medications that are used as well in the treatment of spasticity. The main message here is that these medications can be tried when spasticity is bothersome, keeping in mind there are potential side effects. Some of these medications can cause people to be drowsy. Sometimes they can cause people to feel that they have more weakness, so we always have to be careful. We often start by prescribing them at a low dose, and then the dose is gradually increased over time as needed and depending on side effects.
Are there other treatments, Doc?
Yes, besides medications that are taken by mouth, there are injectable medications. And the one that's the most frequently used is called botulinum toxin. And basically it's injected in the muscle, and after it's injected, usually a few days after being injected, it causes relaxation of the muscle that can last several months, and that can help treat the spasticity as well. In severe cases, there are surgical treatments that can be used, such as the implantation of a pump to infuse Baclofen into the spine, which can be very effective. In some cases where spasticity causes stiffening of the tendons, which we call contractures, orthopedic surgery can be done to basically lengthen the tendons and restore the range of motion.
Are there specific exercises, especially for people who have spasticity in their legs?
I'm glad you brought that up, actually. It's very important. Whichever medical treatment, medication we use to treat spasticity, we always combine exercises. They can be simple stretching exercises. Sometimes they are more complex exercises, and in general they should be taught by a neurophysical therapist who has expertise and can design an exercise program which would be tailored to your individual needs.
What kind of equipment is used in physical therapy for people with spasticity?
There's a variety of equipments. Usually, actually, treating spasticity does not require highly specialized equipment. So it's the same exercise equipment that would be used for other problems due to MS, such as weakness. So often people, perform exercises, for example, on treadmills. When balance is a problem, they can use stationary exercise bikes and other exercise equipments that are actually fairly standard. The stretching is just performed manually, and sometimes the person can perform it on their own. Sometimes they need assistance from a helper, especially if the limbs are very stiff.
What cautions would you give to people with spasticity?
I think my first message would be to acknowledge the symptoms and disclose them to your healthcare provider. And then if the symptom is treated, then to give feedback about whether the treatment is effective, whether it's causing side effects, so it can be adjusted to maximize the outcome so that you can be satisfied with the benefits from the treatment but not be bothered by side effects. Unfortunately, I've seen cases where spasticity was ignored or neglected, and that can lead to additional suffering and interference with function, which sometimes we can avoid with treatment.
What kind of research is being done to help specifically that symptom of spasticity?
There is actually quite a large body of research on treatments for spasticity. Not all of it is in multiple sclerosis, because spasticity can be present in many other conditions that affect the brain and the spinal cord. So we know a lot about the treatments we use in terms of their efficacy and potential side effects, and we're learning more and more about their potential benefits, particularly how they can help with functions such as walking. Thank you for your attention. I hope you found this information helpful. Should you need further information, you can look it up on our website, which is indicated below.